So I think it flashed up. There it goes. It's rolling. So welcome everyone. I've got a PowerPoint to start our process this morning. We've kind of blocked a couple of hours. With a little humor, I always start with saying it shouldn't take that long, and then I end up talking too much, and it always does. But anyway, we blocked a good amount of time so we could really deeper dive if needed, Q&A at the end in particular, and so forth for those that would like to stay on and expand on that, etc. But we do have, I guess there's three kind of parts. I'll go ahead and start sharing the PowerPoint so we can see that. And let's see. Oh, there it went. Okay. Okay, is that showing up, Deb? We're good? Now here's the other problem.
Go for the presentation mode. It's not in the presentation mode.
Oh, okay.
Yeah, I can see the records. It means notes.
Yep, my cheat sheet to come up in a second. Oh my
Yeah,
goodness.
we have people coming in, so I'm admitting.
Yeah.
Yeah.
So, good morning. Display setting, go to display setting, switch presentation view. On the upper left corner of your screen, yes, display setting. Yes, swap presenter view, slide view.
Okay, is that better?
Good.
No, it's the same.
It's the same.
How is that? So, do you have double screens, right?
I do.
So, press on that. Duplicate slide view, right?
You have one screen that does not have the notes.
So maybe you are sharing the screen that's showing the not the slide show.
Right.
Maybe you have to end show and share.
Yeah.
Yay, it takes a village, y'all. Thank you. Yeah. Now the next thing is just figuring out, yeah, I've done this 197,000 times, and now the little, I'm looking for the forward arrow.
Are you using a laptop?
Yes.
Then the right mouse click. Okay.
Did that do it?
Mm-hmm.
Oh my gosh. Okay. Well, again, we've had these teachable moments here, but thanks for everyone's help. And we practiced the other things, but who knows what'll come here in a second. But let's get back on point or on task in regard to our kind of plans for the day. So this should hop us over. So kind of our plans for the webinar this morning. One is, as we shared out, we wanted to really concentrate on an overview of programming expectations for faculty, in particular within UME, of course. And so then further, what support do you have to develop your IEP? So it's more focused on, we have a program planning guide that can be followed to help lay out an individual extension plan. And then further, there's step-by-step instructions on how to actually do that in the system. And so we will go to the system. So there's going to be three main parts here today. One, we have an intro PowerPoint. We're going to go over a few things as it relates to expectations of planning and so forth, and how that might be concentrated and so forth. And so sometimes these are a little bit of a challenge because we have folks on today that have never done an IEP. And then we have folks on that may have done 40 in their career, or we have folks that may have done 40, but they're looking to maybe change and do an entirely new approach to their programming and so forth. So there's multiple levels of need of information and training and so forth. So this will be more baseline or grounded, I guess, in the process. But also helping folks to understand what guides us as we develop the IEPs. And so there's information in that without question, as well as, you know, training components. So I rarely join any session anywhere that I don't get something out of it. But what I recognize is that we may have folks that some of this is going to be, they're perhaps beyond that. And then others that, you know, they're a benefit to be more at the beginning. hopefully when it all comes together, there'll be things that will be helpful to everybody that's made time to join today. So I mentioned we have some content. We're going to share that. Then we have a program planning guide that is available online on UME Answers, but we're going to step through it because it gives us step-by-step instructions. So with that said, as I speak to this here in a moment, there's not a particular need for you to take notes and so forth unless you choose to. If you learn that way, that's fine, because the guidebook is available for you to access in PDF and download and so forth. And so we're going to work through that. Then we're going to take a break. We're going to come back, and then we'll have a little commercial from Dr. Patra about some of the broader things that our unit does. And then we're actually going to go to the IEP system site, and we'll kind of step through one, how to get there, two, what you're going to see when you arrive, three, what you click, how you begin to populate, and we'll just kind of step through each of those, and then we'll transition into a Q&A for folks. So that's what will happen here over the next bit of time. So let me, again, to kind of get into what today is and then what today isn't. So again, today is really about the basics of program planning expectations on a broad scale. Extensions work needs to lead to impacts. So we're going to really speak to that as you think about your individual plan that you will follow that would lead, hopefully, to meaningful impacts for the organization that are made at the societal level and that align with the priorities that we have in our college, our areas of emphasis within UME, and then your localized needs, whether those are driven by constituents, residents in your community, or stakeholders, or industry, however you happen to work. We have folks that are county-based. We have some that are in our city program. We have some that are state specialists that join today. So you just have to kind of put the lens on that you may have as you think about the influence of the impacts that you are trying to make. Again, some of our folks, very industry-focused, I mean, huge economic impact that comes when they work with a broad industry across the entire Delmarva Peninsula, as an example. And then others it's localized, which are equally significant and important, and so forth. So just put whatever lens on that you have as you come to the table. So that's what today is: the system, the expectations, how the system works, and then where you would go to put your IEP in. What it isn't is there'll be some other trainings that will be held. So we will have a humor system use and expectations and so forth, an overview of federal reporting. It takes a team. So in our program and organizational development unit, Dr. Patra will be part of these as we move forward. Dee Dee Allen, who's on today, will be part of some of these trainings as we move forward into the future. We have other peripheral folks that work with the unit that will be offering things. So we will have that, as I shared, one July 1st in the director's letter of expectations and program planning focus for the coming year. And then we sent the reminder out about these different dates, but just an opportunity to reemphasize them then. And then November 17th, all of these will be recorded as an aside. We'll have one on developing a meaningful impact statement. So that's where we'll really deeper dive into the idea of program planning with impacts in mind. So it's great. We have an expert, Dr. Patra, among us, who has visionary thought as it relates to not only program design, but then also how to evaluate that to capture those very meaningful, intentional impacts that we lead to and so forth. So we'll have a session on that. And then on December the 1st, then Jackie Takis actually will present a CV workshop. While the CV itself isn't part of, let's say, the program planning process, there is a need to develop that as part of the required elements to submit as part of our annual review. But then it also, when you do your CV, it kind of helps guide where we see some voids and then how that might influence your programming into the next year. If you feel that there's an area of your curriculum vitae, the collection of everything that you're doing, that may need to be enhanced. So we will have those as we move into the future. So I mentioned about Dr. Hanson's letter. Let's just go ahead and speak about that. We have a slang term in Simons Hall. We call it the famous July 1st letter. So every year the director sends on July the 1st a letter of expectation as it relates to programming expectations, and then further what the annual review process will be, both for staff and for faculty. So I would imagine that Dr. Kim will send that out as well in similar fashion. But around July the 1st, because that's our new fiscal year that's launches the year each time. So that's why that goes out around July 1st. But just this excerpt, I went in and highlighted a couple of things. So you need to target October the 14th to kind of have a draft of your IEP ready to submit. There's some stops and starts that are in there that you can review. There's a broader calendar that's on UME Answers, and then further within the director's famous July 1 letter, but where you, depending on your role and who you work with, but you would, let's say, if you were county or city based, you share your draft IEP with your city or area extension director. If you're departmentalized as a specialist, you might share it with your department head as well, as an example. But there's some targets that are in there. But then eventually, so you'll get some comments back from them. You can make some adjustments, and then it goes to program leaders. And then your final submission would be on November the 14th. And then our program leaders will wrap up any comments and so forth. And basically, we're looking to wrap all this up so we're ready for the January 1st program year. So that's how all of this happens. So it's a very iterative process, lots of back and forth, good discussion. We'll touch on that a bit more as you think about how to move forward. I emphasize this in a slide here in a bit, but I'll say it right now. It takes think time. You have to intentionally set aside time to really think about your program and the direction that it needs to go. And it's not something that could be particularly hurried. So I strongly encourage you, even though the date is October 14th for the draft, it would be very difficult, especially if you're starting from scratch, to start this on October the 13th. Very difficult. You have to really give some thought into what your programmatic ideas are, your plans, and depending on the longevity of your time with us, some of you may be in the process of doing assessments to develop baseline data. And of course, that's an important part of proving impacts. You have to figure out, where did I start and where did I get to and what difference did we make? And so there's some of that research that has to be done potentially, as an example. So much thought has to go into this. And there's support for that to discuss, to enhance that. So that's why we made a big old help screen here, just to draw attention to a few things. So as mentioned, Dr. Patcher's on. So Deb is our program director for evaluation and assessment and a number of other things, but she's very intricately connected with our federal reporting process, and with that said, is able to advise and counsel as it relates to some of the data capture that would be needed and anticipated, as an example, plus just general survey design and helping folks to understand how to intentionally plan programs with intentional outcomes and impacts in mind, and so forth. So some of those take more one-on-one conversations. And so we're open to that. I'm happy to meet with anyone and talk with them about that, to discuss it. Dee Dee Allen has joined us today. Dee Dee works very closely with the Watermark system and the submission process, the system where you go in and actually put your IEP in, as an example. So sometimes if things aren't quite working right, or you need a little more tutorial and how to access that, then Dee Dee is just an email away and can set up a phone call and chat you through some of that, or could respond in kind. The other folks, though, that are here to help you, of course, your program leader. It's not just an approval process that they will go through. Your program leader, and for those that are departmentalized as well, maybe the department head might have some influence with this, but they're really looking to partner with you to carry out the larger picture goals that your program area has. And with that noted, they're there for advice and counsel as it relates to building those program plans, so that it leads to meaningful impacts down the road. So yes, there's a utility of them approving it, but they're also a resource for you to counsel with in regard to the programmatic emphasis and the things that you might want to intentionally focus toward, and those types of things. Further, your area extension director, and I correct myself here in public forum, I should have put city director also. Antonio's with us today, so if you're in Baltimore City, have a good discussion with them. So the thought there is that often our city or area extension directors have insight of our constituents, stakeholders, residents, while we ourselves have that as well, they are in meetings that relate to, budgets and expectation of elected officials and some different things, so they can speak to some of that, that as it comes back to how there's identified needs that are in community and so forth. So they can be invaluable to you to help with that. They also have a strong connection with our EACs, our Extension Advisory Committees, and often those folks that serve on our Extension Advisory Committees will give insight to and bring insight to things that they feel that the community needs for us to work with and work around and so forth. So another important resource. And then, of course, depending on the stage of your career, some of you have mentors that are assigned, whether you're tenure track or whether you're professional track, regardless of that. If you have a mentor assigned, and so they're another individual to be sure that you would want to access to and discuss with them, the intentionality of the programmatic direction and so forth. Further, as it relates to your colleagues in, if your county or base as an example, and there's a programmatic cluster in our area, clusters that are there, often we might come together as a collective group. Maybe in the entire Western region, as an example, there's a specific need that the broader 3 counties have. So you might come together and collectively you all do a similar program, same thing, in any of the other clusters. And then you could aggregate the results of that and show much more meaningful impact because it's across the entire geography of our programmatic cluster in our area. And so with that said, it's good to consult with those that you share county lines with. Sometimes there's opportunity to do things on a grander scale as compared to just working independently. And further, if you're a state specialist or you're at one of our regional education research and education centers, again, there's colleagues together with there. So I draw attention to this because especially for those that are more recently joined the organization, it's not just a scenario where you yourself would have to be at your desk or at your computer trying to think through all of this. There's plenty of folk to help you if you reach out and as you reach out. And those that can give you advice and counsel that have lived a bit longer or worked a bit longer and having been through what I call the school of hard knocks. And so those are great folks to be able to draw on. And any of them I know would be happy to chat with you as you think about how you might move your program forward. Further, I'll say we have folks that may have worked a number of 20, 25 years, but maybe they're branching into a new programmatic emphasis or programmatic area. Similarly, there's folks that may have worked in that area before, and they'll be able to help it with advice and counsel, as they move forward. So can't emphasize that enough. So let's go ahead and kind of hop into a few things as it relates to program planning expectations. We're going to touch on some of that. Some of this will really relate to your IEP is really basically a logic model. And that makes you shudder a little bit. There'll be an opportunity, as I mentioned in some of the other trainings, to more deeper dive in logic model development and so forth. And while we'll touch on some of those points here today, again, there's opportunity for deeper dive. Today is more about some of the utility tools that are available to help you build your IEP and get that into the system and so forth. But as we led with the idea that we wanted to touch on programmatic expectations, we can't do that without discussing some of those pieces as well. So one of the things as it relates to, kind of a logical sequence of your program plan, how you will design a program that would lead to meaningful outcomes and hopefully impacts, is you have to start with the end in mind. So we can't emphasize that enough. So you have to think ahead 3 to 5, maybe even 10 years down the road. In this construct, our IEPs are developed to align with the UME strategized plan. So our strategic plan is on a 5-year process. It sunsets in 24. So we'll begin a process to review and revise our strategic plan. But we had a goal. UME had a goal that from 2019 to 2024, as that year ends, that we would accomplish some things. So the strategic plan is available and, to review, like, what were the big picture goals? Where do we need to get to? And then as an individual, you kind of take a step back and go, okay, what piece of that am I going to get? What piece of that will I have? And then that helps you to think about big picture goals, years down. So starting with the end in mind is very important. Too often we just hop into starting to do educational programs, and people probably will come, they're interested, they may show up. But if you don't have an intentional sequential approach to your programs that then you can evaluate and capture data on to demonstrate meaningful outcomes and impacts, then you should have put more thought into it. There's several influences of that. One is we have to prove our worth to our federal partner. We have almost 11, maybe now $13 million that comes in from our federal partners. But similarly, we have state funding, we have county funding, we have constituent-based funding and grants and all of these things. So people expect us to have accomplishments. And so you have to think about, where do I want to get to? Let me emphasize that again, because I said it like 3 slides ago. It takes think time. You have to really, really make time to think through this. And so it's not something that can be hurried. And so can't emphasize that enough. So where do you want to be in 3 to 5 years in this particular construct? But then later, especially if you're on tenure track, or if you're a professional track, you're looking to promote in the future. When you look for mandatory review, there's some expectations of teaching and service and scholarship and various things. All of that has to be planned, and you have to think that out, especially with your big P programs or major programs. And then similarly, if your aspiration as you think forward to promote to full professor or principal agent, and you need to be ready for that to demonstrate the impacts, you have to really put forethought into that. So can't emphasize that enough. So that's why I wanted to do it again. So the other thing that's important is this issue something that's relevant? It aligns with priorities and that we have resources for. So I speak to that because there's all of these things. It's important that it lines up together. These thoughts of maybe you personally have an idea, an observed need or an interest, but you also have to take that step back and say, does it align with the college's major initiatives, our UME priorities? Then also, how does it align with your localized needs? What are your constituents saying that they need, and so forth? Then further, as a faculty member, whether it's tenure track or whether it's professional track, you evolve an area of expertise often. You become known, renowned, whether it's within our state, whether it's across the nation or international. You often become renowned with a programmatic area that you develop an expertise around. So there's opportunity here and intentionality for you to build a program plan that takes advantage of that area of emphasis. So just a very light example, as I were making a plan, and I know that I have 2 major areas that I focus on programmatically. One is international programs and our diversity, equity, and inclusion work, specifically along support of LGBTQ+ children. With that said, much of the programs that we design, that we carry out, that would offer to enhance people's knowledge of DEI principles, as an example, I would also do presentations on that at national meetings. I would write a journal article on that based on research that I may do, as an example. So just to pick on myself. So similarly, as you do your program plans, you need to incorporate all of that. Is it relevant to our priorities? Is it something we have resources for? Is it meeting all of those needs? So it's really a lot to think through, because sometimes we may have personal interest, but it doesn't necessarily align with what we were hired to do. Perhaps it doesn't align with some of the priorities we have. And so we just have to kind of take some stock of that, as we think about, how we might move ourselves forward. So I just want to touch very, very briefly on this. You'll get more, there's opportunity for further trainings and so forth, but it's challenging to get into our program planning expectations without emphasizing this. As you think about some of the stages, the categories, the process that you might think through, again, many of us, we start here. If you can see this cursor circling, when we think about we want to do a program, we just immediately start down here on this level, inputs, what I have available to me that could be put into this. But then secondly, I hop right to the activities. That's the first thing we do. This is what we call them outputs, but what are the activities? What are the workshops, the offerings and so forth? And again, to emphasize this, what we really have to do is to think about where do we want to get to, these end results of this major program, and then start to work your way backward. And the way that we get to impacts is people adopt what we're telling them and they practice it, they make a change, and that change leads to some adjustment, whether it's incidences of diabetes or maybe economic growth in some of our agricultural commodities, or it's a reduction in phosphorus load in the bay, or it's leadership life skill development of young people, or whatever it happens to be that you're focused on. But this practice change doesn't come before we teach them something. And so we have to let them, they need new knowledge. They have to have aspirations. They have to absorb that and then make a decision that they're going to accept it and to do something different, perhaps. So this kind of progression is something that's very important to think through, that we keep saying, you need to think with the end in mind. And then the IEP is basically mapped out so that you build all of the steps into your IEP that will lead hopefully to meaningful outcomes and eventually to some intentional the impacts that are meaningful to our state. So I keep emphasizing this is about societal expectations. Another thing to think about often is we might come up with a result and we may communicate that result out, but we also have to ask ourselves the question, why would society care? So what we did that? And that's we'll do another workshop that's coming up in November on how to write a meaningful impact statement. And again, as I said, to write a meaningful impact statement, you have to have had designed a program that included evaluation and included opportunity to garner and gather results and interpret that data and so forth. So again, there's other trainings that we held where there's deeper dives with that. One of the ideas of that being able to communicate an impact or the outcomes of your work is, did the outcome make any difference in the folks that we work with, the folks that are in our communities and so forth? So you also have to ask yourself that question, well, so what? That's a little harsh to say it like that, because I know we all are very passionate about the work that we're doing and we think it's amazing. I think you're fabulous. I mean, everyone that works in extension understands the bigger picture. But if you ask yourself that question, and then you have to drive to understanding what that answer may be, it's significant. I'll use this very short anecdotal example. When I first was a county extension agent, I was actually an agricultural agent. And then we also, I was in Texas and there was only two. We had an ag agent and an FCS agent. There weren't 4-H agents, that didn't exist. With that said, we did a whole lot of everything. So I would, as an example, even help with the county 4-H nutrition project and bring in the agricultural emphasis, and then my FCS colleague would focus on a different part. But I draw this because it was a big deal in Texas to do a food show. At the end of the children would go through 6 weeks of nutrition education programming, as an example, that often led to them they would make something and there would be an opportunity to exhibit that at an achievement event. And at that achievement event, then there was judging and there was tasting. Now we wouldn't do that in 2022. There's no tasting anymore, but it's really more about nutritional knowledge, cost per serving, all of that. So all of this thing happens. What I'm driving to is that I would often then put those results in the paper as an example. And my emphasis may be on, we had a 4-H food show and, little Johnny was first and little Jane was second. And, that's great. Many people love to see little Johnny and little Jane in the newspaper, as an example. But if you take a step back from that, you really have to think about, why would society care that we're teaching nutrition knowledge to children or to adults for that matter, and so forth? So if you take a step back and you kind of frame that differently, I use this newspaper article example. What may be better to lead with is that, childhood obesity is one of the leading health plagues in this nation. It causes this much economic impact on us. It causes this much in healthcare costs and so forth. To deal with that, to combat that, we're teaching nutrition education knowledge to youth. And here's how we were doing it. And here's what the children learned. and they had an opportunity to present their knowledge to us. And oh, by the way, Johnny was first and Jane was second. So it's a different spin. It's like, why would society care? And so you emphasize that, you know, and if you think about that and you plan these programs in your IEP, and as you're mapping it out and so forth, then that helps you to think about the really significant programmatic approach that you might take. So very important stuff. So I have a little fun thing I want to also differentiate. I want to say this, in your IEP, what your program leader's looking for, and in the broader organization, is we're looking for you to plan really large, your larger scale programs. We call them big P programs, and they're supported by small P programs. So I use this as a light example, back to being a county agent. When I was a county agent, I might have somebody, they might have saw me in the grocery store. I was in a more rural county. You couldn't walk up and down the grocery store aisle without somebody stopping you and asking a question. It was a very different world there than what I experienced here living in a very urban environment. With that said, they may say, hey, Jeff, you know, I'm the, you know, program chair for the Lions Club, and we'd like a program on fire ants next Wednesday. Could you run by and do a program on that? And I would, of course, I'll come run do that, you know. So we use the slang term, and I'd have walked out of my office that day, say, hey, I'm going to the Lions Club to do a program. So we use program quite often, and so we use that as I'm doing a presentational, an educational workshop. That's often used. In this construct, when we say a big P program, we're talking about your really large area of emphasis. We talked about where you become an expert and so forth, but you more likely have 2 or 3 significant programmatic big P things that you really focus on, whether you know, it's whatever your programmatic area of our big 4, but within that you develop an emphasis. And so your program leader is looking for you to really design a situation statement and a response, this big program that would lead to meaningful impacts and outcomes and so forth. And then within that, you might do, you know, 20 things to support that during a given year, but it's this big P program that you're striving toward. And then under it, you're going to have a number of outputs or activities or educational workshops and things that you might be working on. So all of that is mapped out. So I thought of this fun example. I just wanted to use this from a family perspective, but we also experience this in our families. So think about this. And I promise you, well, I'm hopeful this will make sense as we come back to this. So in our families, often, I draw on this, my family, we love to go to the beach, and we love cruises and things like that. So my partner here, Mark, on the left, we happen to be in Hawaii. And so it was an amazing trip and a fabulous time and so forth. On the right, there's our children, happen to be on a cruise. And so that's something else that we do. That takes a lot of lift as a family. I mean, it takes a lot of time. We have to put a lot of thought into it. We have to plan months in advance, maybe 2 years in advance, you know, way in advance for that. We have to save money. We have to maybe make some critical decisions, priority decisions as it relates to our family budget. We're not going to do X and Y because we're going to go do this. And so it's a heavy lift. So even in our family, sometimes we do these big scale things, but you have to really put a lot of thought into it. It takes intentional approach. It takes deliberate sacrifice. It takes prioritizing and so forth. So a comparative difference would be, you know, maybe my neighbors come by and say, hey, y'all want to play cards Friday night? Sure, we'll run over. Well, that didn't take anything. Or y'all want to go to dinner? That didn't take any, you know, that was we might have gone and done an event or an activity, but it wasn't this large scale event. So similarly, I'm hoping this analogy is making sense. Similarly, you know, in programmatic areas, there's some things that we're doing that it takes a lot of work, a lot of forethought. It takes intentional planning and so forth as we move ourselves forward. And there's episodically, there's going to be things that come in especially when you're a field-based educator or you work, you know, whether it's county or city, people asking to do things and so forth. But those aren't the things that we're expecting you to plan every detail around. It's the big, large scale things that you intend to carry out. So just like a family, if you were going to purchase a car or a house or some big life event, you would have to make a large plan to do it. So similarly, you're going to do something that's going to have a major impact in your community, in your county, wherever you happen to be. And it takes all this deliberate thought and incorporated ideas to make all that happen. And we got to get to know each other's families a little bit better. How's that? So let me just touch on this. We continue to emphasize this about keeping, impacts in mind and big programs. It's difficult to talk about IEP development or program planning without touching on this. And again, there's deeper dives that can come. Deb has great expertise in this as well and can chat with people more meaningfully and so forth. But when you think about extension program characteristics, this umbrella, it says big P program. So under it, you may have see letters 1, 2, 3, 4, 5, 6, 7. You may do 7 or 8 workshops, program series. Maybe they're virtual, maybe they're in person, however you want to do it. You may do multitudes of things that you're offering to the community in any given year, but all of them ultimately support this umbrella program that you're trying to build. And so when you map out your IEP, when you map out your program plans, be mindful that you have this large big P program, but you're going to take chunks of it. And in the IEP system, it affords you the opportunity to even break that down by months. January to March, this is what I'm going to do. April to May, this is what I plan to do, and so forth. And then it leads to more meaningful impacts. So here's an example of big, family consumer science. We have 4 major programmatic areas in our organization. And then there's a big P program, and it's financial wellness as an example. And if that's something that you're doing, but you might do multiple smaller things that help to support that. So those are your outputs. Those are the things that you're doing to help funnel to that big P program and further those intended outcomes and hopefully eventually impacts that you hope to make. So very important to think about that. I just continue to emphasize it. I'll further kind of expand on that. So within your IEP, since that's the concentration here today, just continue to think about your IEP as your individual response, IEP, individual extension plan, your individual response to our programmatic plan, our larger scale approach, both from a strategized plan, the strategic planning process, and then further, many of you work in larger groups. You work with task forces, or you work with action teams, or you may work with a larger multi-county group and so forth, but each of us takes a piece of that. So this is your individual approach that you're going to take, but be mindful that it's part of the bigger picture. And so just something to continue to emphasize and think about. The IEP is meant to guide your programmatic efforts during the calendar year. So as we move this forward, so it's set up where it runs January to December. And I've had people, when I was a program leader, I had people, I called them splitters or lumpers. Sometimes I had people, they split out everything. They wanted it more as a calendar system, that they would put design their big P program, and then in the outputs, they would put almost weekly or monthly, exactly all the programs that they're going to offer. And then I had others that were lumpers, and they would put larger, things together, and they just had within that guiding time frame of that quarter some of the larger scale accomplishments that they were looking to make. But your program leader will advise and counsel you on that. Quite frankly, when I was a program leader, as I hired newer faculty in, I probably was looking for way more detail, much more detail, as we were thinking about the programmatic plan, as they were in infancy, at inception, and so forth, as compared to someone that had worked with us 20 or 25 years. But frankly, by then they know the drill. They've worked autonomously. They work very independently. That's part of the amazement of having the jobs that we do. And with that said, we may not need that level of detail because there's enough experience, professional experience, and so forth, that we know those things are going to be carried out without that being split out into the IEP. So it just kind of depends. And so you can seek counsel from your program leader about that, about things that might be looking for. Regardless of all that, I just, this is emphasized, it requires a planning method to achieve the program outcomes and impact. So that's part of the IEP process. So I'm just going to touch briefly on this next one, which is basically, I said earlier that the IEP is really, it's a program, it's a logic model, really. And so this is a little bit challenging to see. So I should never have to say that in a PowerPoint presentation. So if I said that, I should have made it bigger. But it follows the same things. If you'll see over here, these are our outcomes and impacts. And that's where we need to start our mind, but recognize that to get it going, then we have to start way over here with what are our inputs, what do we have available to us to help jumpstart this program. Then further, what are our outputs? What are the things we're going to plan to carry that program out that would lead to these? And in the middle of all that is also thinking through your evaluation plan, thinking through how you'll survey people. If they're large scale and you're thinking to publish, if you're thinking to present at national meetings on this content and so forth, there's multiple things that then there's IRB requirements, institutional review board that need to be followed. There's just multiple things that have to be thought through as we think to move ourselves forward. So I really wanted to emphasize that strongly before we get into the utility of the system and the process. We've said this before, so we'll kind of emphasize it again, but we think about what impacts will we have at the societal level, or you could insert at the industry level that then lead to changes at society level and so forth. So that takes thought. It takes a lot of thought. And that's why I said think time. And it can get overwhelming. And so that's one of the nice things about the IEP, because it forces us almost to kind of chunk it into manageable components as we move forward to a larger scale area of emphasis that we would want to move forward with. We wanted you to recognize also, as you develop your IEP, I'll sometimes hear from people that it kind of sounds a little overwhelming and scary to them, but be mindful, especially if you're newer to the organization, or maybe you've worked longer for the organization, but you're starting a new program. Be mindful of, you're not going to have impacts and outcomes the first year, highly unlikely, or perhaps even the second year, and maybe around the third year, they'll start to come. So there's short-term things that will happen. And that's where you're working with clientele, with residents, constituents, and so forth, as we mentioned, that would lead to, and we teach things, we have workshops, we have educational series, maybe it's done in person, maybe it's done online, maybe it's a series of webinars or newsletters or video conferencing things, or whatever it happens to be, but you have some approach that you're taking. And it's kind of these chain of these events that leads to these impacts eventually in these outcomes. But you'll begin to see, again, because it's a large scale program, you've really put a lot of thought into how you're going to design it, what outputs you're going to offer. So it's not just hit or miss here and there. It's very, very deliberate. And as you offer those, and that guides your, it guides your time, it guides your week or your month, the things that you put your emphasis around, then that would lead to these outcomes eventually. And that's what we're looking for you to design around. Again, we know, especially those of us that have been in county offices or in our city office and so forth, there's lots of distractions any given day. Someone's walking in the door with, my grass is dying, or what's this bug, or I've got this on, whatever it happens to be. And so there's sometimes many, many distractions, but our programmatic, these emphasis is something that would be very meaningful and intentionally designed and mapped out and so forth, that would be very important. So I just want to emphasize real quickly, because there's a difference between these long-term outcomes and impacts. So, these long-term outcomes, the participants' conditions change. They do something different. They make a change. They adopt your practice. They take the knowledge that you've offered and so forth. This was an example. If Michael Alonge were on it, maybe he is, maybe I missed him. But anyway, this example of inmates' economic conditions have been improved and so forth. So that's an outcome for individuals and so forth. But what are the design change at the societal level? So rates of recidivism or reoffending. I picked on Michael. He does a lot of financial management training in our to incarcerated individuals, so that when they leave, then they're better able to re-enter society, but then also it leads to less recidivism or reoffending and so forth. There's been some amazing work that's been done with that. So that's the societal impact, that reduction in recidivism. That, we did this program, we did it directly with them. It happened to focus on financial wellness of some of the folks, but eventually it led to them not reoffending. That was less of a drain on our tax base. I think now it's like $58,000 a year to incarcerate someone. Well, that's a multiplier factor. If you can keep 3 or 4 people from reoffending and so forth, that's significant, as you think about that from a multiplier effect. So just a light example of something that we wanted to interject. So again, the reason I'm emphasizing this now is because when we're doing these program plans and we think about what are the bigger picture goals, we have to really think about what ultimately do I want to get to. And for many of us in the organization, maybe it's an increase in profitability for individuals. Maybe it's a decrease in the incidences of foodborne illnesses or something like that, that then, lead to medical costs. Maybe it's improvement of water quality. Maybe it's, of course, building a child up that then eventually, as they enter into adulthood, they're better suited. And then, maybe they're better, they pursue a career that they have more earning potential, which contributes to the tax base, etc. I mean, there's multiple things that can occur, as an example. So again, it just takes some emphasis or some thought. Last thing that I'll say as it relates to this is, again, and Deb can expand on this and help to support people, but be mindful as you do your program plans and as you think about your IEP, there's a question in the IEP process about what is your evaluation plan? What are you planning to do to evaluate this program? So you have to think about that. So this is just, often these are referred to as the, kind of big 3. Deb may have 5 more, but we can design, surveys, and we have Qualtrics available that the organization buys into that Qualtrics system where surveys can be built and made available to people, and the data from that can be drawn on, etc. But anyway, so there's different survey designs. Some of our program areas have those surveys already ready. Actually, they have those available for folks to potentially draw on. Some of our large scale curriculum projects, they already have those designed. And so those are ready to be used. For some of us that come in, maybe you were hired under a large grant project. There's some expected deliverables that are associated with that. Maybe you're a part of a larger project that's nationwide. Maybe they already have these designed. There's sometimes those are available, but oftentimes we have to design our own. And we have expertise in the organization, Deb being the individual that's able to really emphasize that and help to advise and counsel as people think about survey design and how they would capture those evaluative pieces and so forth. And so I just wanted to really kind of re-hone in on this about the situation statement, because that's something that you'll have to start with when you do your IEP. You're responding to a problem. That's basically often what we do. We respond to a situation. There's something in our community that we need to help with, and our constituents have told us that. So that's why we say start conversations with stakeholders, program leaders. There's other resources available. Our strategic plan, as an example, secondary data that's out there to tell us. We don't have to go do all that data gathering. It's already available to us. When they surveyed, thousands and thousands of Marylanders to maybe have an area that might align with the programmatic emphasis that you may have. Or it may be that you do need to do a needs assessment. Many of our folks will come in. That's one of the first things they do when they start their new position, is they do a needs assessment of their community to find out what do you need. And we can help you with that in program and organizational development as well. We can advise and counsel about how to do that. That is, in a perfect world, an amazing way to start one's program, because again, you start with that baseline data So it's much more both defensible and probable that you'll be able to get your baseline. You're going to take an action. You're going to plan a big program. You're going to have outputs and potentially outcomes that will lead to impacts and so forth. If you thought it through and you designed it so that you have that needs assessment at the beginning, however you gather the data and so forth, then it's a great springboard for you. Again, think time. It takes a good amount of time to think through that. Sometimes, though, we're not able to do that. You come into a position and, man, you hit the ground running. I mean, the day you start, there's people stacked up at your door. And so we realize that. So sometimes we have to draw on more research theory, published research. We do a literature review as an example to gather that up. We draw on other anecdotal data that's available to us. In your IEP, though, that's one of the first things that's going to be asked. And some of our program areas have written situation statements because many folks will have a similar program in mind. But depending on what you're doing and what you're carrying out, you may need to develop that. But again, there's research data that's available for you to be able to gather that information. So this is just a short example before we get to our last slide here for this part, but it's just a situation statement example that we had available. So we speak about food safety, we emphasize that. Interestingly enough, Deb has a background with that as well. So if you need to chat about that, she certainly can. But food safety is an important public health priority. What's the situation? Well, the situation is 1 in 6 people are getting sick. Further, 128,000 are hospitalized. What does that cost? My gosh, that's tens of millions of dollars that might cost. And then death, my gosh. So, they're dying of these foodborne illnesses. So that's the situation. And so then you, depending on your program area, you may have some response. We have huge programs in our aquaculture program that emphasize this. Similarly, in our ag and food systems and family and consumer science programs, we have folks that concentrate on this as an area of emphasis. And so that's the situation. And then, so it's kind of at big picture societal level, but then what about Maryland? What's happening here? What about my county? Or what about Baltimore City, or et cetera? So you just kind of work your way, that's the big picture, and then work your way backward to why, it's an area of concern that you want to address. And so then just the last things here, as we wrap up is, again, I mentioned about logic models. That's a whole course in and of itself and so forth. But most of the time when we say logic models, people shudder. They're scary to folks and so forth. They're not so scary. In fact, once people really understand them, it's like an aha moment where they go, wow, this really helped me to map out my approach to my program much better. But that is what the IEP is. The individual extension plan was intentionally designed to step you through. When you come to the screens, you're going to start with the situation, and then this is the priority that I'm addressing. Here's the area of emphasis that we have in my program area. Here's what I'm planning. And then you intentionally think through how you'll evaluate that and so forth. It just steps you through step by step by step to build this program plan that then you'll work off of during 2023. So with that noted, I'm just going to land this there just a second. Actually, you know what? I'm going to go to the next one because I wanted to emphasize this. So as you know, within the IEP system, our program planning process is we typically plan 80% of your time in a given year. 20% is episodic, things happen. Again, though, we plan 80%, but life happens, or some pest comes in to our county and takes us over. And so I'm derailed. I have to go take care of that. Or we've had a major, maybe something happens in our community that causes devastation, a weather event or something. Things happen, they do. So we plan it, but then we leave 20% that's just for us, so don't plan every second of every day. And then, but within that 80%, also recognize that some of the program areas, your program leader, of the 80% that you're planning, they're also looking for you to assign 100% of that time. So all of your 80%, they're looking for you to divide that among some of the priority areas. So I layer that in here now. When we get to the program, when we actually go to the live site, you'll see what I'm speaking about, because you put in, I'm giving 50% to here and 30% to this and 20% to this. And that helps them to know where you're putting your major emphasis and so forth. So as was the outcomes and impacts, again, I can't emphasize that enough. You have to envision, and then you make a plan to meet them. And I just underscored this, cannot emphasize this enough. It does require think time. You have to set time aside to work on this. And so I recognize that as you think about that, that there's a couple of, it can be overwhelming. And so the next section of this, what we're going to do before we take a break, is that we're going to open the program planning guide. We're going to have that available. I'm just going to show you, it's a printed resource. So if you're like me and you've worked for almost 35 years and you're the age I am, I'm going to print it and I want it laid out on the table in front of me. And so I look for the program guide. I would draw on that heavily. Others would just look up online and away they would go. But there is a program guide to help you. So that's the thing that we're going to look for next before we take a break. So I'm going to stop sharing that, and then we're going to call up. So I think there was a couple of things in the chat. So I can't, Deb, did you look at those yet?
Those are mostly good morning. You know.
Oh, that's great. Very nice. Okay. Here a little bit, we'll be back to, I just wanted to check in before we do that. Okay, well, let me share again, because I want to get to our, the guide that I had mentioned. And so, okay, hopefully this will do right. Okay, is that showing up?
Yep.
Okay, so we have UME Answers. It's a site. Dee Dee happens to be very principled in the, not just the design of that, but the management of it, the design of it, upkeep, all of it. We're driving people to that. So on UME Answers, in a minute, when we go to the live site, I'm actually going to step you through how to get to it. So you'll see all the screens. So I'm going to pretend I'm you, and we're going to eventually get to the IEP entry site when we come back from the break, and we'll go through it. Prior to even getting there, though, there is a program guide that's available to you that follows the programming expectations. And so I already had it open. It's in a PDF. You can download it from the UME Answer site. Again, in a minute, we're gonna go together, so you'll see exactly where I'm going. But from a so that I didn't have a lot of clunkiness back and forth, I just already opened it and had it available for you. So on about page, oh goodness, I think it was about page 8 or 9, in the program planning guide, it starts for you about how to build the IEP and what the format is and so forth. So it steps you through back to support and things that are available to you. It's just chunk step by step by step to help walk you through it. And then again, we're going to the site in a bit, and we'll do a kind of a live version and so forth. But so we started getting started. So there's absolutely screenshots that are in there about once you go to the IEP system, watermark success, it's going to, this is what it's going to look like. And so there's just in the guide, it's showing you with circles exactly what you're going to come through or come to. So just to emphasize this though, as an organization, whoops, pop to the next thing. As an organization, we went to our last strategized approach. We did take a 5-year approach to things. So this often causes people a little bit of angst because, okay, but I'm starting this year. What does that mean? You know, what do I start out? I mean, do I only do a 3-year plan, or do I do it, you know, and so forth. So I think it's important to think about, we recognize that you're going to have bigger picture goals and vision and so forth. But in the IEP system, we're basically building it so that during the 5 years, which started in 2019, or the first programmatic year was 2020, we developed a plan that we were going to meet some significant outcomes and potentially impacts with. With that said, then each year, they're basically just refreshed and tweaked And so that's typically what would happen. But then just think about what 2020 brought for us, and 21 and 22. So those were huge shifts that had to happen in our approaches. So you don't have to start over, each year. You're just building on, but you might want to make adjustments based on, again, life happens. Maybe something happens in your private life, your personal life. Maybe you're not able to take on the larger research project that you thought you would. Maybe a funding source didn't come through that you had expected. I mean, there's all kinds of things that would need to be adjusted. So you can adjust this as we move ourselves forward, and then in council with your program leader and so forth, and your area extension director, you can make those tweaks as we move forward, toward the end of our strategic planning section. And then, of course, we're not going to stop extension then. We'll start to develop a new strategized plan, a new strategic plan for the next 5 years. And more likely, our program planning process will evolve to meet that. We may not have the exact same IEP system as an example. Maybe some adjustments will be made and so forth. But for now, this is the one that's built. With that said, if you started in 2022, right now, then you plan for the first, to 2025 or the first. This gets a little confusing because 2024 is the last programming year that you would plan for. But at the end of that, then that starts 2025, of course. And so that's where you would want to target. But counsel with your program leader and your mentor and others about, I know I'm going beyond that. What are my bigger picture plans? But what can I accomplish in that time frame? So that's how you start to build this individual extension plan. So when you come into the system and it says 5-year plan statement of work, just recognize that this was originally planned from 20 to 24. And so whatever you plan to accomplish by 2024, if you're just joining the organization, then that's what you're going to put in. So we have examples that are here. And as Dee Dee and others had originally built this guide, there was things that we would extract out just to give you a few examples. So even though it says ag and food system, if you happen to work in that area, kudos for you, because there's a great example, but others, that may not be what your screen looks like once you get into it. But we're just drawing attention to the idea that you're going to plan. I mentioned earlier, as an example, Dr. Jarboe, we're planning 80% of our time, and within that 80%, he's looking, and I believe that ENR and Sea Grant takes the same approach. Then Dr. Hubbard is looking for folks to then divide their time up among these major. I'm trying to increase the size, y'all. It won't do it for me, but they're looking for you to assign time based on these major categories in areas of emphasis and the strategic initiatives that we have. So again, the college has big picture initiatives. The system is intentionally built so that as you build your individual extension plan, you select, what am I doing and where does it align with the college's initiatives? And then there's a whole initiative guide for that to help us. And then further, within UME's strategized approach, our strategic plan, we have areas of emphasis within that as well. And so they're all mapped out. So you'll just start to kind of click things and begin to select the areas that your the big picture program, your big P program, the time that you're assigning, it's going to ask you. So it's going to guide you. The system itself will guide you, as well as this guidebook as you go to develop it. So I mentioned think time. Again, I encourage, whether you view it on a screen or whether you print this off and have it with you. Often people start with just a sheet of paper in front of them as they begin to jot ideas and thoughts and so forth. But knowing what you're going to be asked for when you go into the system is very important. Obviously, that shapes the approach that you may be taking. So that's why we always want to make sure that we have that. So here's an ENR example. Here, the next one is a family consumer science, FCS example, about percentages of time based on priority program areas. In the major areas of emphasis that Dr. Kim has worked with her team on are included. They're there and they match in the IEP system. Each of our program leaders works with Dee Dee each year to refine, revise, adjust, and tweak the IEP system based on current needs if something occurred that needed to be shifted. So I mentioned about kind of readying for this is there's a couple of things that would be asked for. Again, family consumer science. This next one is if you work in 4-H youth development, Dr. Fields is looking for enrollment targets for youth that might be enrolled into the 4-H program, whether it's through community clubs or whether it's through short-term interest groups or outreach or however it be. That takes some thought. You have to know, where am I at now? Where do I want to get to? If I'm looking to increase from 200 kids to 300 kids, what will it take for that to happen? Do I have to start 3 new clubs? That's a heavy lift in a year. That's a lot of work to start 3 new community clubs. So you have to think through, and if that's where I'm putting my time, I may not have time to invest in other areas. So maybe that's too lofty a goal. I mean, it's things to an iterative approach to outcomes that you want to eventually reach that helps to shape this process as you move yourself forward. So fortunately, this guide is available for us. I mentioned about major programs or priority areas. Again, this is already built in for you. So some of our program areas already have situation statements that have been mentioned. Those are available, and if so, those are mentioned here. Then you just begin to build your plan. And here's an example. 4-H faculty will be asked to emphasize there's 6 priority areas. Building community and civic engagement is an example. Developing leadership workforce and so forth. There's just so you have to think through. Same thing with our other program areas. They're going to ask you some areas that you would need to check off or to prioritize as you move yourself forward. So all of this is leading into, you have a situation, and then you're helping us to know, and the thing I intend to address is also aligning with this priority area, with this initiative that the organization has, with this action that my program area expects and intends. All of that is the precursor that comes in to then you then telling your program leader, your extension director, or your department head, however you happen to come to us, about what program inputs you're going to put in. So program inputs are, this is the support I have. These are things that are available to me to carry out this work. So I had a situation, it's aligning with these priorities. These are the program inputs that I know that I have available. And it could be a collaborator. It could be a grant that comes in. It could be a funding stream, something along those lines. Those are going to be some inputs. But it also affords us the opportunity, if we feel strongly that we're going to move forward with this program area, to realize, what don't I have? What am I missing that I need as an input to help carry this out? If I don't have enough funds to carry it out, I need to write a grant, or I need to meet with my program leader about how do I use my startup funds. It could be that there's equipment that need to be purchased and acquired. How would we go about doing that? What program funds do I have or available to me? All of these questions have to be asked. So very important to think about the inputs, things that have available. And so these are just some little, a chart that gets us thinking. Here's some inputs that more commonly are drawn on when we think about what we have that may be available to us by program area. So that's available in this program guide. And then we start the output. So now we're going to get into a section where we start to plan the things we're going to do, what we're actually going to carry out to work toward a meaningful change in people's knowledge, skill, and so forth. Hopefully that would lead to them adopting the practice. That's an outcome, and hopefully to some impacts. So we just plan those out. So by program area, depending on which area you click, when you go in, which area you work in, some of these screens are going to show up. So both our Ag and Food System and our ENR and Sea Grant educators indicate or they describe these outputs that they intend by category as compared to calendar time, like by now within that, you might decide, oh, this is what I'm going to do the first 3 months of the year, but under the idea of research and scholarship, teaching, service, and others. So the nice thing about this approach is that it really readies you for the annual annual review process. It also readies you for 3-year review, 5-year review, mandatory tenure review, or promotion in our professional track system, because these are the areas that there will be a review around. And so that's being built a little bit differently. Some of the other program areas do it, as I said, FCS and 4-H are doing it quarterly. So the outputs are within the calendar. They're going to do it so that by quarter, you share what your plans are. So all of that is mapped out. And then again, some of our program areas already have the outcomes predetermined. There's some common measures, might be a term that would be used. Like typically they would look together to say, what is most consistently outcomes that we'd be looking to accomplish in our program area? And so those may already be available. Again, those may or they may not be, depending on your program area, but this is where you can begin to kind of with the checkbox system, begin to click the ones that you feel that you would strive toward in these program plans. And, same thing with FCS. And then if it's not in this system, they're housed elsewhere. So if you work in environmental, natural resources or Sea Grant and so forth, there's a box folder and there's a link to it that you can click on. Just land on it in the document and control and mouse click and it'll take you to it. But in that box folder, once you log in, there's support components that would be available to you. So those are things that you can look forward to. Again, back to support and so forth. And then we talked about measuring. So there's going to be some questions about what do you intend to do to measure this? You have to have a plan to evaluate, whether that's by survey, a tool, an online system, a paper form, whatever it is that you happen, to be planning. You'll have to think through that and be prepared to input that into the system. There'll also be a question about professional development. So we've explained that. So we'd like to hear, where do you intend to go to seek professional development to help enhance your skill sets as it relates to your role within the organization and to possibly help you carry out the program that you plan for. I once had an educator that they were doing a large scale STEM program, science, technology, engineering, and math. They were going to focus on drones. And so they wanted to go to a training on being a drone pilot. And so they had to build that in. And it was just kind of a little, as they came, they had to think through, like, how am I going to support the program that I wanted to emphasize that this is a workshop, a professional development opportunity that I need. So it wasn't the common kind of more standard, I'm going to my professional association meeting, or I'm going to a workshop here in the state and so forth. So sometimes you need specialized training and so forth. And so you've got to think through that. And then the last thing that would be that we're going to emphasize is we have questions about not just affirmative action and so forth, but some of our program areas also have a little bit of a deeper dive for your plans to reach diverse communities, underserved communities. There'll be text boxes for you to think through. What might you intentionally do to make sure that folks realize that these programs are available to them? If they're not coming to your programs, what are your specific plans that you might want to carry out to make sure that we reach those? So I see one more chat. Oh, Karen had to hop off, so she was saying thanks. That's fine. So again, we'll have an in-depth Q&A here in a little bit, but at this juncture, let's all take a breath, a bio break. We'll be back in about 5 minutes. Let's come back together at 11:25 or so. Deb has some things she's going to share with you about our unit, and then we're just going to go to the site together. We won't have to go as in depth because we've stepped through it in the program guide, but I want to show you how to get there and what you're going to see when you arrive. And then we'll take the last 15 minutes for questions and answers. So, okay, we'll see everyone back here at about 11:25. Thanks.
Okay.
So, yeah, as the group comes back in, I think I shared, we take advantage of every opportunity we can to really showcase our newer unit that's been formed in the organization, program and organizational development, and the breadth of things that are available and so forth as a unit. So Dr. Patra is a significant part of that unit, being the program director for evaluation and assessment. And so she's going to share some detail about that. So Deb, take it away.
Thank you, Dr. Howard. Well, as the story goes, I joined about 6-7 months ago and conducted a needs assessment survey with all of you through Jackie. She has been very helpful. And one question was, what do you want POD to provide you, or what kind of services you expect from the program and organizational development unit? And the comments, majority of the comments that came back was, what is POD? So I was like, oh, wow. So it's a kind of outreach from our side to let you guys know what POD is, who we are, what we do. And it's as Dr. Howard mentioned, it's a new unit. We had some kind of activities that were going on in different aspects, but now we are a new unit and we are trying to design and develop and centralize a lot of resources for all of you. So thanks to Susan Barnes, who was very helpful in designing this flyer for us, which we use now for the outreach purpose from our unit. We are 2 people now for the time being, but don't underestimate the number. We are very well equipped to provide you all the resources, services, and support that you would need for your professional career development and all other aspects of your career. So Dr. Howard is the unit head and the program director, and we support faculty when they come in during their onboarding for the program design and other purposes. And then we also provide different kind of professional development things. For example, today you're learning about IEP. It is for everybody. It's not just who got started, but who the existing faculty members are. And we do program planning and evaluation. We also provide resources for teaching effectiveness, give that training, individual extension plan training, and we also provide annual faculty evaluation and promotion tenure resources that goes through our unit, and impact reporting, mentoring, and Qualtrics and IRB support. And I have been tying up IRB support along with the program design. So when people come to me for IRB support, I take them back again to their program design and say, okay, we can make things better and go this way. And we have publication support as well, and signature programs goes through our unit. And we are also tasked with the federal reporting. So federal reporting is basically to make sure that we get money for all our programming under all the proposals, Smith Lever, RRFA, and all of that, capacity funding, because we can show that we have been impactful, doing great work. So please continue the funding. That's what we do. We are not alone. We have been heavily supported by very key individuals that you see on this flyer. One is Mr. Andrew Kling. He is the managing editor for the Extension Publications. And Dr. Howard is also heavily involved with that process as well. We have Susan Burns, who is the graphic designer support for the publication unit, but then she also helps out with other kind of designs that we are needing help with. And as you all know, Miss Dee Allen, she is very famous, and she does quite a bit of work in UME Answers and any other things that we have at UME. But for the purpose of our unit, she does quite a bit of humors, that data that goes for the reporting and other planning purposes. Then UME answers, and then she has been hosting this program Central that you would see in a little bit, and where we host all the materials and stuff for the smoother functioning of all of our purposes here. And Jackie has been heavily involved with the APT and AEP coordinator, and the training goes from our unit, but she is the coordinator for the means promotion and tenure. And we all work very closely with each other, and I just wanted to throw that information with you. Thank you. Now it's over to Jeff.
Thanks, Deb. Yeah, so let's take the last 30 minutes here. One, I did want to just kind of quickly go to the site. Again, we've kind of looked through it in the guide that was available that we looked at a moment ago, but we actually want to go to the site. We're just going to step through together. In a second, I'm going to show you how to get there and so forth. But I do want to just underscore, as we presented today, it's in a broader scope of thought about kind of a program development process and approach. But you may have some specific things depending on your, not just your program area, but where you work and so forth, that might come to you as it relates to the expectations of IEP development and so forth. You know, a couple of examples, some of our large scale, like our SNAP-Ed program as an example, there may be some variation depending on that because of the way the grant comes and the expectation of program delivery and so forth. And so there may be some specialized approaches that would come to you as a result. I see that Dr. Escobar is on with UMES, the administrator for our 1890 program. And so there may be some specialized expectations that Dr. Escobar has along with their team that might be communicated out. And while there's a similar program, you know, the platform is similar in regard to the development of program plans, that there may be something that's a little bit different as you accessed it, depending on the area that you work in. So just be mindful that those types of things may come to you. And of course, if that's the case, then they would come. Somebody's going to send it to say, this needs to be done differently, or we're going to do this within our part of extension and so forth. So our emphasis today, again, was back on this bigger picture thought about program planning, and then also as it relates to where for our University of Maryland Extension College Park has a system available to be able for our folks to put that in, but all of the information is applicable to a broader group for sure. So I did want to then just also touch on, as was mentioned, how do we get to this site if you've never been? So I'm going to, hopefully this will work. And again, we practiced earlier, so hopefully it will work. Deb, is that showing the website? Okay.
Yes.
All right. So Dee Dee's going to throttle me. She might scold me later, but I can never seem to remember how to get to UME answers. So I just cheat and type it in, and then it'll pop up. I just type in UME answers, and then it'll kind of do a thing to take us to the site. And so once you get there, what I'm driving to is to just show you some of the steps that will get you to the IEP system. And there's actually 2 or 3 routes that you could go to get to there. One is this is a section called links. And so there's multiple links for staff and faculty development and so forth, other policy pieces, all of that. So there's a section in there that's related to it. But Dee Dee maintains all of this, or gives oversight to all of this with support of others, I'm sure, but she's our go-to with that. but we have a section, program and organizational development, that POD that nobody knew what was until Deb's done such an amazing job marketing us. So if you just typed in UME answers, it's going to get you here. Then click on this, and hopefully that's going to take you over. And then we have this really fancy wheel that Dee Dee was kind enough to design that's going to pop in. And it shows kind of all the major components that are here that are available. So there's one called, this is all the things that were mentioned, support components, publications, teaching effectiveness, Qualtrics basic, all of those types of things. Promotion resources for P&T or professional track or tenure track. And so that actually takes you over to the site that Jackie maintains along with the resources, et cetera. But anyway, in the middle, if you were to click on Program Planning Central, it's going to pop up this page. So we're still in process. There's a couple of things that we need to refresh, but regardless, if you get to here, then it's going to get you to that site. So here it says, start your IEP here. So we'll refresh that for 23 as we look forward, regardless whether it's 20, 22, 24, what it's getting you to the same site. So we'll work on that. But if you click on that, it's going to take you actually to a page that has a whole lot of different things that we put in as faculty members. So as you build your faculty achievement report, as an example, there's a site for that. Our teaching, we had mentioned about inputting information for that is there. There's also some pieces associated with our UMERS reporting system that we have to report that data to the federal government and so forth. Again, Dr. Escobar can advise about for UMES as they do their reporting system and so forth, or gather that data and so forth. But anyway, there's multiple things that are on this page. I'm getting to my point, which is this is where the IEP development is also parked. So you'll look in that program guide that I went over, the PDF, it shows you the steps. So this is where you're going to land. University of Maryland Extension Program Planning. So there's some things that are in, if you're in an area where you have to put in an annual data dump, for lack of a slang term, you'll know that. And so that's where you would go do that. But these are the 4 major program areas that our organization has. I say that because some land-grant universities extension systems also have an area like Community Resource Economic Development, CRED. They have 5, or they may have some specialized area, depending on their part of the country they're in and so forth. We have 4 major program areas of emphasis. So depending on your role and your assignment, your PHR appointment, all of that, you'll know your program area. And so that's the one you're going to click. So I'll pick on 4-H since the cursor was over it, and it's going to open that. Well, I don't have squat. So there is the opportunity, you have, your prior year's plans. There's a process where that can be copied and drawn on and so forth. So I don't have the full knowledge exactly of how to do that, but Dee Dee can advise on how to do that. But in the program guide, as was mentioned, there's some instructions associated with that. So you kind of bring your previous plan forward, and then you use that as a basis to then go and make adjustments and edits, changing dates, changing targets, all of those types of things are available to you. But if I were new, I would say, or maybe I've worked for a long time, but I'm going to start a new program area. I need to add a new one to this. So that's where you just click add new. This is explained in the program guide that was mentioned. And then here's where it starts. So you're going to tell us the year, the planning year. And again, we're in this planning cycle of 2020 to 24. That doesn't add up mathematically to a lot of folks, but that actually is 5 years if you do the count, because at the end of 24 is our 2025, of course, starts the next day. Anyway, I mentioned to you about what your plans are and so forth. So in 4-H youth development, you're going to ask about what is your plan statement of work? What is it that you plan to carry out? Again, big P program, not all the minute detail, because every day we all have things. I start, every morning making you can't even see that. Anyway, making a list of things that I need to do. So we're not looking for that. It's these major programs, and then eventually the major outputs, the major significant things that you plan that all align with this target that you have of having outcomes and impacts. That's also supported, surrounded by, if you take a smart approach, you'll also align that where all of the scholarship that you develop, the curriculum, the research, your journal articles, your fact sheets, all of those things are going to align back with those major programming areas. So you get not just a 3 for, you get a 17 for, to use a slang term, where you get 17 great things out of having one area of emphasis if you think through it well enough in advance. So everything I spoke about earlier and work through that PDF document, that's kind of an annotated approach, where there's examples and things that are included. But this is what's on the screen for you. So there's in the program planning, I mentioned earlier about where you're going, when you actually get to your program plans, where you start to build them, you're going to have to select some of these things if you work in 4-H youth development. I mentioned about this major area of emphasis that 4-H has. So they've been smart. For years, the past probably 7 years, the approach has been that we're going to target 6 major areas, and everything we do is going to align under that. It also aligns with the college's initiatives and with our UME strategic plan and so forth. That's why they can write a logic model, and they can have that is available to everyone. That's why they can also have common measures, common question sets that they might draw on as they build survey instruments. That doesn't mean that they still have to go through IRB processes and so forth as they build something, because it's for their portion of it. But those questions have been developed, they've been vetted, they've been checked for the validity, all of those types of things. So because they've done that, then they're able to annually publish results. They even have statewide surveys that youth take as they enroll. They take that survey to see where they're landing in some of these pieces. So our other program areas have that too. Depending on your program area, there's different areas of emphasis and so forth. But as you come in, this is where you'll start to find those things. So it's basically, they're just showing you some of the key pieces of information to help ready you. So I talked about situation statements earlier. Again, what's the situation in your county? If you work in ag and food systems, you may have a concern. Maybe it's profitability. Maybe it has something to do with other areas related to that you need to draw on based on the needs that you happen to have, not only in the county that you're in, but there could be some community emphasis and so forth. What is the situation? If you work in nutrient management as an example, there may be a broader situation that you're addressing and the plans that are being written and so forth. So if you're in SNAP Ed, that situation statement may be more readily written and so forth. So just depending on where you're coming in and what you're doing might have some emphasis on or influence. So I mentioned earlier about enrollment targets. If you work in 4-H, Dr. Fields wants to know what those are, the progression of how many youth would be involved in the 4-H experience. And then this is where your major program area starts. So you have to title it. If it were me and I was working in international programs, as an example, that might be my major emphasis. But then I have to say, where does that align with the AGNR initiatives? Again, it's written for you. It's already there. So you just go through and you make a decision about how that aligns. But then similarly, as mentioned, 4-H has an area of emphasis. We had mentioned about the situation statements, and then also this area for inputs. For some reason, that's not moving anymore. There we go. I need to click the cursor back on it. So that happens when you have two screens. And so we mentioned about inputs. It's like, what do you have available to you? So there's some examples, definition that's been listed. And then they further break it out by these major areas of club enhancement, short-term high quality experiences, and then development of the practitioner, which could be volunteer and staff and so forth. Then opportunities for growth. So as you look at this, and again, that guidebook gives you this detail, this readies you. So these are inputs. Maybe you need an extension specialist to support you. So you make that known. Who might that be, and what would you work with them on, and so forth, or assistance from others. So that is, sorry, this keeps freezing up, but it's going to step you through. Oh, now it's listening to me. So anyway, it just continues on. But and then there are specific questions about increasing access and inclusion and so forth. And so she wants to know that. And then this is where we get to the outputs. You remember FCS does this the same way. They put it in by quarter. So the first quarter, I have a big picture I'm getting to, a big P program. These are my big vision. This is what I want to do. But for this year, this is what I'm going to do to kind of take a chunk of that all leads to this bigger picture. So you could just do it by quarter. Maybe it's there is an educational series that you're offering. Maybe you're writing, or maybe you're launching a research project, and you're doing that the first January, March. Well, by the end of the year, maybe you analyze the data and you're starting a journal article as a result of that, or it led to a new curriculum that you need to design and develop or something. So you would put all of these types of things in there. So that's just for 4-H. So I'm not saving that. And again, your screen may look a little bit different than mine because of my administrative access, but generally these are the same things that would be available. So I picked on 4-H. Now people are going to be mad at me if I don't pick their program area, but I don't know that I'd be able to do all. But let's land on ENR. I mentioned FCS and Ag and Food Systems a second ago, and so let's just land on that. So you see there's already, you can begin to ready yourself because there's some of these major priority areas that are in there. So you're going to add new if you work in that area. And then I mentioned both in Ag and Food Systems and in ENR and C grant, both Dr. Jarboe and Dr. Hubbard are looking for their folks to assign a percentage of their time that adds up to 100. It gives you the detail up here above, not to exceed 100, of where they're putting their major emphasis. And that leads to a number of things. One, it helps us to be able to have intentional focus, but then also to build action teams and collaborative groups. Once you see, okay, I've got 9 people that have 50% of their time assigned to a particular area, it would make good sense. Those folks are going to get together and they're going to probably do something as a collaborative project. But then it breaks out again, whether you're in aquaculture, master gardeners, natural resources, our forestry program, climate and energy, and so forth, et cetera. So they have these other, this broken out. So I just wanted to show one to drive with you together to get to the site. So here's what we would say. Dee Dee would, I'm sure, echo this with me. You cannot break the system. You can't break it. So feel free, get in there and start playing with it. Dee Dee probably also has a trick to delete out a plan you didn't intend to save or something. I don't know, so don't feel like that you are going to make a mistake or something. I mean, it's an iterative process. I strongly encourage people to initially, when they write their situation statements and some of these other more text versions of things, just, you can do it in Word first, and just, massage it, work on it, just kind of, there's, the nice thing about having the program guide is it's going to tell you the things you need to ready for, so you can just build it almost as a template if you chose to, depending on your program area. And then you'll be ready by the time you get in there. And again, it's an iterative process. You can build one, you share that with your city or area extension director, maybe a department head and so forth. Save it and send it to your mentor. If you have one, say, hey, would you mind looking this over? Quite frankly, ask your mentor for theirs. Say, can you show me your IEP from last year? Of course, they'll share that. I mean, there's other folks, maybe they're working in a similar area and they say, here's some of the things that we've been doing. So I'm just going to stop sharing that because so that we'll have a little bit of Q&A time. And that is where the site is and where you'll begin to populate it. Again, be mindful of the dates. If we can help, if you want to schedule an individual session, I've had a couple of folks reach out. When your program leader is with you to make final decisions about their expectations of you as you know, one of their direct reports, and so forth. Again, our area or city extension director may have some specialized things that they need to make you aware of as it relates to the needs of the local community and so forth. But they would guide you with that. But if we can help advise and counsel, give thought, especially to the thought about evaluation and surveying and the ideas of creating a meaningful program when you think futuristically, I'm happy to chat with you. Deb has expertise in survey evaluation, programmatic design, all of those types of pieces as well. So feel free, you know, to reach out to us. So I'm just going to look together in the chat. There may be some questions in there. Let's see.
Yes, so one of the questions was, what will be reporting under civic changes under impact SEEC? How would we measure that?
Yeah, so a lot of times we have to rely on other data, because we may not be in a situation where we're able to do that scale of a study. And so we have to rely on secondary data to be able to do that. And so that's very often done. Sometimes there can be, I'm sorry, I'm trying to see the people. That sometimes can be done by, I mentioned secondary data, but like there's an entire, if you work in youth development, whether it's through FCS or you work in 4-H youth development and so forth, there's an entire site called Kids Count that gives you, you know, this extraordinary level of detail and data and so forth. So with that said, you may draw on that at that juncture to be able to measure, you know, to give you some baseline of when you start your program. Well, similarly, we have enough confidence in some of those civically engaged groups and so forth that they're going to continue to provide data like that into the future. So look at it in 5 years and see where you may be at. The challenge with it is this, is we can take our piece of it, but while we would love to save the world, more likely we're not. We're not going, it's going to be very difficult to move the needle on many of these large scale issues. But we have seen improvement. I mean, you know, take our watershed group, our aquaculture group, our nutrient management group. Many of these folks that a number of years ago, there was strong concern about the Chesapeake Bay and the potential, whether it was based on, you know, population density, our urban population, what was happening based on water runoff, or people thinking it was agricultural producers, whatever it happened to be. Everybody's rallied together and we have an approach to try to improve the health of the bay. And so that needle has been moved. And so you're seeing improvement with that. Now, the challenge is with that is how much of that can we claim and how much was other people? And, you know, so you kind of get into this. So a lot of times that's about a 5-minute response to a 30-second question. But the idea is for many of those things, you have to rely on secondary data because we may not have the capacity to do those broad scale studies like that.
Thank you, Jeff. And there are some resources and that has been answered. So we can open this forum for discussions or questions. If anybody has anything that they can just open their mic and share.
Now, I'm just scrolling back through some of these. So Mona had a question about removing prior years and so forth. So even though like the situation statement, more likely you would leave those years. If your situation statement includes from 20 to 24, you know, that was the situation that we were faced with, and this is what I hope to accomplish and so forth. There's no need to strip out that. But I would say in your output section, the things that you plan, those definitely would more likely need to be emphasized for 2023. So with that said, you may have the exact same ones. Maybe it's the same plans that you intend, the same things that you intend to carry out. Maybe you weren't able to carry them out with the pandemic and so forth. And so you just concentrate on the calendar year that we happen to be coming into. There was also a light question about, we talked about publications. That also relates to program development process, because many of you plan around your scholarship, publications that might result from some of the work that you're doing, some of the results that you have, and so forth. And so we are refreshing that. There's a couple of folk that Deb mentioned, Andrew Kling, who's our managing editor, and Susan Barnes. They're working on not only refreshing our training tools and so forth, and the guidelines. We're also looking at the different categories, and then further we're doing looking to do tutorial videos and so forth. We met last month and we had a 6-week target of working on some of those pieces. But yes, we are looking to refresh that, in amongst the other things that are happening as we can. That absolutely is moving forward.
Hey, Jeff, as an added to that, I saw the site yesterday that they're working on, and it's a really good resource. We've never had a resource this nice before, so it's coming along very nicely.
Wonderful. Mona, go ahead. You have your hand up.
Yes, regarding that publication, because I was planning on submitting a fact sheet within a month. So I just need the guidelines. So would I say, should I just wait until everything gets, since you guys are working ground up, should I just wait and not submit it?
No, I think you could move forward. Yeah, as we mentioned it, it's more how we can enhance things, how we can put refreshed instructions. But the fact sheet is fairly historically steeped within extension. So that approach, there's really no need to wait on that. Further, both Andrew and Susan are willing to meet with folks at inception. So Mona, if you wanted to schedule a time just to actually chat with them about, here's my vision or the idea that I have, and then they can advise and counsel as you think about. Susan's just invaluable as it thinks about what's that going to look like on our in HTML on our website, and that might influence how the fact sheet is written or kind of chunked, for lack of a better, those types of things. So we can absolutely move forward on that.
Okay, but I will not be able to find the guideline on how to submit online, because that's what I'm looking for. It used to be a step-by-step, go here, do this, open an account. Well, is this online? I think that's what I'm looking for.
Mona, I can help you with that.
You can, okay, thank you, Didi. I'll get in
You're
touch
welcome.
with you.
Yeah,
Thank you,
I'll
Mike.
get that for you.
Thank you, Jeff, appreciate it.
Yeah, no worries. So as that brings up, and you think about program planning, it's a great point. I'm glad Mona brought that up, because when you think about, if part of your program plan is that you want to publish a publication, a fact sheet, maybe a curriculum and so forth, how long does that take? What's the process? What's available for us? So we have the fast track system where things are put in, but in your outputs, you would put some markers in there for you to be able to have the manuscript ready. And then who are your reviewers going to be? What process would you want to use? So that's a great thing to plan for, because when you think about, an example, I was very proud personally to publish one of the first ever nationwide research projects on the inclusion of LGBTQ plus children in the 4-H youth development experience. Our oldest respondent was 75 years old. And so it was so wonderful to hear from that. But that took 18 months for me to do all of that, and then to publish the journal article with it. So you have to think about that and think backward. And again, if you're going up for mandatory tenure review, or if you're looking to promote, whether as a professional track or you're looking to promote to full professor or principal agent, and you need those scholarship components, you're going to have to work backward and really think through that, because some of these approaches. It takes time, and you never know whether you're going to be accepted at a national conference to present on your program. Maybe you have some program outcomes that you want to present on, but you may or may not be accepted. And so what are your strategies that you're going to use? Chat with your mentor, chat with your program leader about approaches to be able, to access those. And then sometimes, regretfully, we have, it's a challenge for us financially with travel to get to some of these things. So if I don't have the funds to go to X and Y, what are some other options I may have? So a lot of think time that it takes to go through these types of things, for sure.
It's 12:01.
Yeah. So
Don,
Thank you,
you want
guys.
to say something?
I just want to say thank you very much to Jeff, Dee Dee, and Deb for all you do. And I thought although I've done a few of these over the years, I thought I'd pop on to see if there was anything to review, renew, or catch up on. But thank you very much. Great job.
Well, Don, thank you. And we appreciate you. And separate from John's personal gain, imagine the number of people that Don mentors. And so now, knowing this, I really appreciate the invested energy and time to be able to further support folks, having heard it, up close and personal. So thanks, Don. Those were kind words. So with that, as said, we will send the recording link out. There's some folks we had, they registered so they could get it, but they weren't made it known they weren't able to join. But we appreciate the robust group that we have here. Further, we're going to capture the chat in case there's anything in there that we need to make sure that we can address offline. And so we are certainly happy to do that. So with that, thanks everyone. I'm so glad to be with everybody today. And again, we have these other trainings that are coming up. So some of that is deeper dive into some of these specific elements. So thanks everyone. Have a great rest of your day.
Thank you.